Angelina Jolie has revealed she's had a double mastectomy. The actress says that this was done because her mother, as a preventative measure, because her mother died of the disease, and that she had a very high risk of contracting it herself. She carries a gene which puts her at high risk, and she's urging other women to check if they too are vulnerable. She has so far had 3 months of surgical procedures. Dr. Charles Serrurier is an expert in plastic and reconstructive surgery and joins us now. Good evening and thanks so much for coming. And of course, the fact that Angelina Jolie has had this done has suddenly put this in the spotlight again. How common is it for women to have elective mastectomies?
It's not uncommon at all. There's a large proportion of patients that certainly come to us in our unit that have breast cancer genes and carry the breast cancer gene. That's what Angelina Jolie has got. There are also a lot of patients that are very concerned because they've got a significantly strong family history of breast cancer, seen their mothers die, aunts have breast cancer and be treated, that are also concerned. They might have a genetic predisposition to them, however we don't necessarily know exactly what those genetics are that are causing this.
So it stands to reason, of course, as you say, if people have a history of that in their family, they should go and get tested. Which other categories of women should get tested?
Well, every woman in South Africa and every woman in the world needs to be tested. And we, fortunately, in South Africa have increased our screening program to almost first world levels, certainly amongst the private healthcare system, but even amongst the government system. There's been a lot of hard work, specifically by Dr. Ben, to really increase breast screening and make sure that every woman is screened a couple of times through the course of their life. But certainly, you know, every woman should have their first mammogram at least 40, unless they've got certain other risk factors for breast cancer.
It seems quite extreme, doctor, to remove healthy breasts, because essentially that's what is happening, right? You're removing healthy breasts that are at risk of becoming cancerous later on.
Yeah, that is correct. You know, the problem is that if you do have risk lesions in your breast or poor genetics, it's almost like a ticking time bomb, and it's not are you going to develop a breast cancer, it's more like when are you going to develop that breast cancer. So therefore the decision making is exceptionally difficult, and these patients, you know, they really need to be treated in a good multidisciplinary unit where they've got access to cancer surgeons, oncologists, plastic and reconstructive surgeons and psychologists to help them come to terms with their potential disease and when to perform this life-saving surgery.
And when do you make that decision, when it's time to operate?
It's very difficult to make that decision, but it will be invariably guided by the patient, and the patient will make that decision. Some women are absolutely paranoid, and we've removed breasts in 22, 23-year-old women. Other women are more happy to be followed closely, be screened closely, and as soon as there are signs of any changes within those breasts where it might be potentially becoming a cancer, then we'll remove the breasts at that stage.
But how great are the risks? I mean, in any surgery, just a single mastectomy carries a great deal of risk. Obviously, the risk is enhanced with the double mastectomy?
It is, but look, it's still a surgical procedure, and you know, if you are operated on in an appropriate unit, the extra time spent in theatre is probably only an extra 25 to 30 minutes because it's done as a team approach. Sure, there is other risks of other post-operative complications, but certainly if you're doing one breast or both breasts, it doesn't increase the risk nearly as much as most people would think.
Let's talk about the long-term prognosis, the prognosis for recovery and rehabilitation. What options does a patient have post-surgery?
Well, post-surgery, it depends on the timing of the reconstruction. Now, certainly if it is risk-reducing surgery, as in Angelina Jolie's case, invariably the reconstruction will begin at the same stage as the breast tissue is removed. Okay, so it's not like patients will have their breasts removed, go home, recover from that, and then come back to start the reconstructive process.
So it can all be done in theatre at the same time?
It can, yeah.
So would they choose beforehand what type of cup size they want, if it was the same as, and would there be enough skin and tissue to be able to mould?
Yes, yeah, look, to a certain extent it can be done immediately, all right, except that's not what's done internationally most commonly. Most commonly what would happen is the mastectomy would be done, a device called a tissue expander would be placed into the area where the breast was, and that would be used to stretch out the skin a little bit. You can make patients a little bit bigger, a little bit smaller, increase their cup size, and then after an appropriate period of time that tissue expander device would be replaced by permanent prosthesis, very similar to the prostheses that we use cosmetically.
All right, we'll leave it there. Thank you so much for
Great.
coming in. We appreciate your time, Dr. Charles Serrurier, who is a plastic and reconstructive surgeon.
News that moves. eNCA.com.